without pursuing this coronavirus thing, and I think it's driving people insane, I note these figures from an epidemiology report ending August 2 from Victoria. I'm going to shove something up on the screen in a moment. This is quite something which I've only discovered today. I mean, here they are adding cases from the early days of the second wave. So on Friday, September 4, 59 deaths, they call it a reconciliation. Quote, changes at the national level in how deaths are recorded. What changed in early August? I don't know. Let me say this to you again and again and again. And it's a considered point I make. We are not being told the truth. The US Centers for Disease Control and Prevention said last week that, quote, for 6% of the US deaths, COVID-19 was the only cause mentioned for deaths. Only 6%. In only 6% of cases was COVID-19 the cause of death. But that's not printed. No one has told that story. Mark Latham is with us. And Mark, I know I've sent him a copy of this. This is from page 14 of a document I've got here, and it's called Communicable Diseases Intelligence Report. It's dated the 2nd of August 2020. And I'm told this only goes to doctors. And this is further proof of the fact that we are being, it's a harsh language to use, we are being lied to. It reads, quote, comorbidities were common in those COVID-19 cases, there is on your screen, admitted to Australian sentinel hospitals, they are general wards or ICUs, with 78% recording at least one of the specified comorbidities. Only 9% recorded no comorbidity. It says the proportion of hospitalised cases with no known comorbidity recorded in US hospital surveillance system was also reportedly 9%. Well, subsequently report said that's 6%, but anyway, you get the picture. In sentinel Australian sites, chronic cardiac disease occurred in 29% of hospitalised cases, 30% in the UK, diabetes 32%, and chronic respiratory disease, including asthma, 31%. Mark, bring in Mark Latham here. And Mark, he can't be with us tonight because he's had a COVID test today, I think. Mark, I hope all is well with you. But what are we to make of this? We are not being told the truth.
Well, what the data shows very clearly, Alan, is that about 10% of Australians who passed away, registered as a COVID fatality, were in perfectly good health. The other 90% had a range of various illnesses, a lot of them serious. So it puts in perspective what's happened now with the lockdowns and the economic damage, that in Australia, less than 100 healthy people have passed away from the COVID-19, and at a cost, a huge cost of smashing the economy, a 7 to 8% reduction in GDP, many thousands of businesses closed down, many hundreds of thousands of people thrown out of their job. And if you look at the data for the number of COVID fatalities, the healthy and the unhealthy in Australia, we're spending about $750 million for each one of these fatalities. Now, compare that to what we spend to try and keep a cancer patient alive for a year, or heart disease patient, someone else with a serious disease. It's way out of proportion.
Absolutely.
$750 million for each one of the COVID fatalities, and among those, less than 100 in Australia who are in perfectly good health.